I'm really excited about this next conversation. It's a panel on building power for workers and families. And this discussion is going to focus on kind of another part of the economy where a power imbalance, where concentrated power at the top is constricting economic growth for everyone else. So we talked about the financial markets. Now we're going to be talking about the labor market. We're going to take a fairly broad definition of the labor market here. So not just the power of management to set wages and the lack of worker voice in the workplace, though we will be discussing those issues, but also who gets to even enter the labor market and on what terms. So we'll talk about Black and Latinx and other people of color who face police brutality, health disparities, and other forms of discrimination that obstruct their ability to thrive economically. We'll talk about young people and increasingly older people burdened by student debt, which affects their life and economic choices. And we'll talk about parents who lack access to high quality, affordable childcare, making labor force participation incredibly difficult. So as the panelists join me here on screen momentarily, I'll just say a few more things about the conversation that we hope to have from now until 3:30. So as was true in the earlier conversation, the coronavirus recession did not create the problems that we're going to discuss today, but it has crystallized them. So whether it's frontline workers lacking the power to demand personal protective equipment on the job, Black and Latinx communities being ravaged by the virus, or parents watching the formal childcare industry collapse these last few months while trying to juggle their own informal care arrangements and work. So we have experts on all of those topics here joining me on the virtual stage. The two other things I'll say before we get into the conversation is, one thing that I really want to stress is that the victims here are not just those directly harmed by the policies and systems, but all of us. So when workers are forced to come to work sick, they spread the virus. We've seen that in the last few months. When wages stagnate, so does consumer demand. And when students, parents, and people of color are blocked from bringing their time and talents to the labor market, our entire economy's productivity suffers. So with that, I'd like to introduce the panelists, the esteemed group here that we're going to be talking about these issues. All three of them are actually authors of the Vision 2020 book that Heather referenced earlier. So they all wrote chapters for that book that we'll be discussing. And we'll start with Naomi Zewde, who is an assistant professor in the Graduate School of Public Health and Health Policy at the City University of New York. Her research centers on economic inequality in wealth and in health insurance, and examines the ability of public policies to reduce those inequalities. And her Vision 2020 essay, co-authored with Derek Hamilton, focused on student loan debt. And she actually just with Derek has published a new piece on our website on why the coronavirus recession is an opportunity to cancel all student loan debt. That article and other supplemental materials can be found on the event page that I think was dropped into the chat earlier. Let me do the two other introductions, and then we'll go back to Naomi for the first round of questions. So next up is Taryn Morrissey. She's an associate professor of public policy in the School of Public Affairs at American University. Her work focuses on examining and improving public policies for vulnerable children, including early care and education, nutrition assistance, and public health policies. And her Vision 2020 chapter was on the need for affordable, high-quality early childhood care and education for all. And finally, Alex Hertel-Fernandez is an associate professor of international and public affairs at Columbia University, where he studies American political economy with a focus on the politics of business, labor, wealthy donors, and policy. And his Vision 2020 essay was on aligning US labor law with worker preferences. And he also recently wrote a piece for the website on the collective action responses that we're seeing now to the coronavirus crisis. So welcome all of you. Thanks for joining us virtually. I'd like to start with some questions around the problems as you see them. So let's try to define the problems and how coronavirus has crystallized them for us. So Naomi, as a health policy expert, we should probably start with the health crisis. How has the current crisis revealed and exacerbated fragilities and inequities in the nation's healthcare system?
Sure, thank you so much. I'm glad to be part of this conversation. So like you said, I think that a lot of us have come to this understanding that what the virus and the crisis has done is like expose or exacerbate pre-existing inequalities. So pre-virus, basically what we had in terms of access to coverage is like, you know, you're born in the wrong neighborhood, you go to the wrong schools, you're likely to get a job that does not offer health insurance, and you're likely to have, you know, to die prematurely as a result of a number of different kind of effects. And so also pre-virus, we were kind of debating about what do we want to do about it? You know, I mean, among the problems, for example, Black women in this country, African-American women's maternal mortality rates are really high. So this isn't necessarily, you know, it wasn't a problem of the technology around childbirth and childcare. That's what a lot of the research has kind of started to show us. Instead, it's been about kind of like the relationship with providers, the institution of healthcare and healthcare delivery, and kind of how racism weaves its way into all of these things, and how inequality or like kind of lack of representation weaves its way into all of those things. So, you know, we were kind of coming out of the Affordable Care Act, where 20 million people gained coverage, but we still had a major problem. Actually, I have a paper under review now that shows that, like, for people who were uninsured prior to the ACA and not eligible for Medicaid, basically like the kind of the target population for the ACA's private insurance policies, for about 25% of them, it's cheaper to file for bankruptcy than to reach the deductible of the subsidized benchmark tier of, you know, so it isn't of private insurance under the Affordable Care Act. So it wasn't really, it didn't fully solve the problem, even though it brought us some of the way. And so I think that then when this virus came, it kind of exposed how some of the challenges with having this patchwork system of coverage. And it also, in the fact that it's like infectious, and then it also exposes some of the challenges of having employment tied coverage, which was already inequitable, but which also becomes a lot more difficult to work with when you have an employment crisis.
Right, right. Yeah, we've seen mass unemployment, and with that, a mass, you know, health uninsurance rise, which is a unique American problem, it seems. So in addition to health insurance and health disparities, you've also done a lot of work, I know, Naomi, on generational inequality and the cost of higher ed. It's been hard not to notice that the recent protests that have been led in the streets in recent weeks are being led by young Black people for the most part, who, in addition to facing police violence and discrimination, of course, are also experiencing, you know, 15 years now of real economic turmoil. What do you see as the fundamental hurdles to achieving more generational and racial equity in the country?
Yeah, so I think there's two. In my slide, it kind of speaks to this if you want to pull that up. I think there's these two problems. So one of them is right here in the middle. The Black median household has only 1/10 the wealth of the white median household. And so wealth is itself a generational concept. It's something that is handed down from grandparents and parents to children. And that happens throughout the life course. Like the intergenerational correlation in net worth is pretty strong, like even before or outside of inheritance. It's just something that's just happening throughout life. And so Black people haven't had very many generations to accumulate and transmit that wealth. It was only, you know, the 60s and 70s when some of the educational and occupational restrictions have been loosened. So when you're thinking about wealth on a time scale, it's just not a lot of generations. And also the big social middle class building exercises that have happened in this country missed Black people, just actually, you know, explicitly excluded Black and brown people. So that's a big hurdle that we're facing in terms of like the experience of life for Black and white people. And then on the right side of this graph, in the 99th percentile and the 100th percentile, there's this other problem that's a huge challenge for how democratically to resolve kind of, you know, the distribution of access to resources. And that is like the heavy concentration of wealth amongst a small class of people who are also white. So there's like a white billionaire class, and the wealth that happens to escape their hands does not kind of like disperse itself equitably between the 99%. But these are kind of two separate problems. And so what's difficult about that concentration of wealth is that such a small number of people who command so many resources, even without like being mean, just kind of allocate resources towards solving the problems that are in their sphere or within their vision. And so if not everybody has access to those resources more equitably, the rules that end up being shaped and the institutions that come out of it will favor one group over another. And so I think that what we're seeing in terms of young Black people in the streets, I think that they are coming together and rebelling against both of these issues. So, so it's the issue of the violence of the state and how it affects vulnerable people, like Black people, basically. And also the fact that they are now coming out of the second recession in the past decade. So labor market prospects for young people have been bleak and are looking bleaker. That combined with having the greatest educational debt burden of any cohort of Americans. And so the prices year over year of education and housing and healthcare, they're rising faster than prices while median wages are stagnant. And by the way, you will not get a defined benefit pension. So I think that people are coming in solidarity. I think that especially kind of the tagline of defund the police is about refunding public institutions as well, and kind of thinking about which institutions we want to reinforce moving forward as we're going to have to like rebuild things. Are they going to be the ones that institute social control, or those that kind of spread out access to justice and resources and wealth?
Right. Yeah, no, that's really interesting, and those stats are always so jarring. Taryn, I just turning to you, another cost that young people I know and parents of all ages are facing, it's the explosion in childcare costs over the last many decades. So turning to you now, how has that problem played out both before and now during the coronavirus crisis?
Sure. Yeah. And thank you so much for having me in this really important conversation. The costs of childcare have been twice the rate of inflation over the last 2 decades. So it's a heavy cost burden for families. But the COVID-19 crisis highlights and exacerbates the structural problems we already knew existed in many areas, as David and Naomi were talking about, also in childcare and how parents manage their work and family responsibilities, and in turn have widened socioeconomic, racial, and ethnic gaps in families' experiences and also outcomes. So most parents with children require childcare while they work, at least pre-COVID, and more than 60% of children under 5 regularly attended non-parental care. But as you can see from this slide, before the pandemic, where children spent their time was dependent on their age and income. So children in low-income households and infants and toddlers are much less likely to be in center-based care or in regulated or licensed care more generally. So only about 1/4 of young children in poor households were in center care, compared to about 35% of those in non-poor households. And this is a problem because on average, center care tends to provide higher quality, more stable and reliable care than unregulated types of care, which better supports children's development as well as parents' employment outcomes. And these disparities in early care and education attendance result from the lack of supply, its high costs, and the general lack of public investment. So this is particularly true for children under age 3. So in 2015, annual public expenditures on education per child age 6 through 17, so K through 12 largely, were about $12,300 compared to $1,350 per child before kindergarten. And most of this was spent on preschool, so just the year before kindergarten. Under age 4, very little public money is spent on education, despite all we know about the science of early learning and the early childhood period. So as a result, it is families who are bearing the cost burden of early education at the lowest earning years of parents' careers. So families with children under age 5 spend on average 10% of their incomes on childcare, and low-income families spend 35%. Despite these high expenses, childcare should actually cost more, not less. So due to the nature of care work, the quality rests on the strength and consistency of adult-child relationships. So the economies of scale don't apply like they do to other economic sectors. And most childcare expenses are labor. Currently, early care and education workers make very little. In 2018, childcare worker median annual wages were $22,290, compared to kindergarten teacher average wages of $56,850. Before COVID, more than half of childcare workers lived in households eligible for public assistance. Research shows that early childhood teachers of color are paid even less and have lower access to benefits like health insurance than their white peers. And so what results is high staff turnover, which is problematic for children's development, parents' employment, and program costs. And COVID puts all of these problems in stark relief. Right now, childcare is near impossible to find, as currently most schools, childcare centers, and summer camps are closed or very restricted. And these temporary closures have obvious cascading impacts on children's learning and development, but also on the programs themselves. We know that most childcare centers and homes are small businesses that operate on really thin margins, and they won't recover from months of no or very little revenue. This has resulted in mass layoffs and closures. Even more early educators have lost their jobs over the last few months than K through 12 teachers, and we know quite a few K through 12 teachers have been laid off. And a recent report estimates that 4.5 million licensed childcare slots, about half of pre-COVID levels, will be permanently lost following this crisis. So without swift and effective policy interventions, what will result is widespread shortages of childcare, and what remains will be really expensive and out of reach. And we know that childcare is just necessary for economic recovery, particularly one that's equitable. Before the pandemic, our economy lost an estimated $57 billion a year due to childcare problems. More than 2 million parents nationally, 9% of parents with young children, disproportionately mothers, had job disruptions due to childcare problems. And many parents, particularly mothers, will make the decision to drop out of the workforce altogether, with cascading impacts for their careers, their family's economic security, and the overall economy. And it could set working mothers back decades. And it's going to widen socioeconomic gaps in young children's experiences and their school readiness at kindergarten, with the families of children who can afford, or the children of families who can afford it, receiving these developmentally enriching experiences and early learning, while their peers who can't afford it missing out and less prepared to enter school.
Thanks, Taryn. Yeah, both the short and long-term ramifications seem pretty dire, and I think even folks who normally have the means to afford high quality care, through Zoom meetings, and we're seeing in the background the kids. I mean, it's just pretty evident now that it's impossible to juggle everything, even for those who maybe were blind to that problem ahead of time. Alex, thank you for your patience. Okay, we're going to turn to you. We've talked a lot about Americans being blocked to even enter the workforce because of childcare, student debt, racial discrimination. But we actually know that even once they get there, their jobs are pretty precarious. Schedules are unstable, workplaces are unsafe, and as the current mass unemployment, demonstrates, the jobs themselves can quickly disappear. So as somebody who studies labor relations, what do you see as the core problem driving this fragility?
Yeah, thanks for that question, David, and thanks to the Equitable Growth team for inviting me to participate on this great panel and great event. So like the other panelists, I see the COVID-19 crisis as producing several new strains on the workplace and exacerbating existing ones. So when we think about new strains, I think the most obvious one is, like you mentioned, David, the health risks that many workers face, particularly those workers that don't have the option of working remotely and have to interact on a daily basis with coworkers or members of the public, customers or clients. You also have the economic crisis that's produced by the downturn that we're experiencing. And it's important to note that both of those crises have been felt unevenly across the workforce, that much of it has been borne by Black and Hispanic workers. In a recent survey of essential workers that I conducted at the end of April and beginning of May, I found that Black and Hispanic workers, for instance, who are on the front lines in these occupations, still going to work, were substantially more concerned about being infected or infecting others at their job than were white workers. And on top of that, we know that the essential workforce draws disproportionately from Black and Hispanic communities, particularly Black and Hispanic women. But there's a final crisis, and this is one that I think has existed well before COVID-19 hit, that has only exacerbated what we're feeling right now in the workplace. And that's the crisis of workplace voice. By workplace voice, I mean the ability of workers to weigh in on decisions that are important to them on an everyday basis at their job. So that's how much they get paid, their benefits, the terms of their advancement, how they're treated by their managers, and of course, the health and safety conditions that they work under. And well before COVID, American workers faced a deficit in the sort of voice that they wanted, that they feel like they should have over all of these things, and the sort of voice that they actually had. To put some concrete numbers on that, research from 2017 found that nearly 2/3 of American workers, 2/3 of workers, had less voice than they wanted over the terms of their wages, their benefits, and opportunities for advancement. And even more relevant for COVID, a survey I conducted with the support of Equitable Growth in 2018 with Tom Koken and Will Kimball at MIT found that nearly half of workers said that they either had no say or very little say over the health and safety conditions at their job. But perhaps the most telling indicator that we have of this deficit of worker voice is the gap between the proportion of workers who say they want a union at their job, a formal mechanism through which workers can weigh in on all of these outcomes and resources in their workplace, and the proportion of workers who are actually in a union. So in recent surveys, nearly half of all workers say that they would join a union if one is not available to them right now at their job. But as we know, the union membership rate is at about 10% of the overall workforce, and even lower at around 6% of private sector workers. So clearly there's a big gap between what workers want and what they're getting. So let me bring this back to what we're seeing right now with COVID-19. And as the slide that you put up here indicates, there are some really important differences in the say and voice that workers have at their jobs and how well equipped they are to deal with the realities of COVID at their jobs. So this draws from that survey of essential workers that I mentioned, conducted at the end of April and early May. And it asked workers a variety of questions about the sort of COVID-19 related conditions at their jobs. Did they have PPE that they always used? Are they certain that they would get paid for sick days if they couldn't come to work because of a fever? Did they get tested for COVID-19? And did they have a place and a time where they could discuss problems or issues with workplace safety with their coworkers? Across the board here, we see that members of unions, again, this is looking at the essential workforce, but members of unions were substantially more likely in many cases to report all of these outcomes. It's important to note that these differences don't simply reflect differences in workers or jobs between different sectors, that they remain after we account for all of these factors. And I don't think that should come as a surprise, because we know that this is a central function of unions to provide these kinds of resources that workers need and want at their jobs.
Thanks, Alex. Yeah, it is a striking difference, but like you say, that is, I guess, what unions, were created to do. So now turning to solutions, and maybe staying with you, Alex, for a second, and I'll turn off screen sharing so that we can zoom in on our faces a little bit more. Turning to you on the solution side, given this question of kind of what workers want, how do we give them what they want? I mean, what policies are you pushing for, or do you think make the most sense for both addressing the current crisis and planting the seeds for long-term structural change?
That's a great way of framing the question, David, thinking about what we need to do now in response to COVID and how do we set ourselves up for the kind of reforms that would reduce this deficit of worker voice that people experience. And I think the first thing to say is that to the extent that worker voice helps workers get the kind of conditions that they need and want, it needs to be part of the public health response that states and cities are engaged in. In terms of specific reforms, the Clean Slate for Worker Power initiative at the Harvard Law School just came out with a great report that has a whole bunch of mechanisms and recommendations for achieving that kind of voice as part of a COVID-19 response. I would just highlight 4 broad buckets of things that I think would set us up to increase worker voice now and in the future. The first is just making sure that workers are aware of the rights that they have to a healthy and safe workplace. Research I've conducted suggests that many workers, particularly workers with lower levels of formal education and those who earn lower wages, just aren't aware of the rights that they are already afforded under current law. So let alone that they aren't even able to take advantage of those rights. And so I think something like having a workplace safety and health officer, someone who is elected from the body of workers at a particular work site, could help ensure that workers are aware of those rights and can access them. I think a second important step is ensuring that workers have a say in the sort of reopening conditions at different businesses. And so that means, for instance, having committees of workers and managers that meet regularly and produce standards that the businesses have to follow. And that should also be mirrored at the sector-wide level. If there are best practices for, say, fast food restaurants, we should be applying those across the board in particular states and regions. We need to make sure that workers can hold their employers accountable. We're seeing in this wave of strikes and protests that have happened in recent weeks and months that workers feel like their employers aren't responding to them. And so we need to ensure that workers have that voice to go on strike if they want to. And then finally, we need to create new mechanisms for workers to form unions. As I alluded to earlier, there's just a huge gap between the sort of union representation that workers want and what they actually have. And there's a whole bunch of things that I think workers should be experimenting with the help of local and federal policymakers in order to get that union representation.
And it does seem like the public is at least momentarily behind, the heroes, the frontline workers, and so maybe there's some way to capitalize on that political moment. Okay, snaking back around on this question of big, bold solutions that can make structural change, but also can address the current crisis that we're in, which is a little bit of a challenge. Taryn, why don't we go back to you? What are your policy prescriptions for the childcare crisis that you laid out earlier?
Sure. Well, right now we need short-term relief to keep existing childcare programs afloat, both those that are temporarily closed and those that are serving the families of essential workers. So social distancing, lower child-adult ratios, and enhanced cleaning are necessary for public health, but they increase the costs of childcare. Furthermore, most workers are poorly compensated, as I talked about, and lack employer-supported health insurance, and are more likely to be women of color, yet they're serving on the front lines right now, caring for the children of other essential workers. And there are proposals in Congress for short-term relief to childcare. There's the Childcare is Essential Act by Representative DeLauro and others, and these will be really important in making sure that there's childcare when the economy reopens, which states and cities, as they reopen and parents return to work, it's essential that childcare be considered in economic plans. An estimated 1/3 of US workers have childcare obligations, including myself. So I'm one of those people who often have children running in the background at Zoom calls. And in terms of longer term structural changes, we need to fix the structural problems in the childcare sector that were apparent well before COVID and only made more visible by the crisis. So this finding affordable, high quality childcare for young children will be even harder than it was before, and it was already very difficult. We know that programs like Head Start and other high quality early care and education can promote children's development and parents' employment. And we need much higher sustained investments in early care and education. These programs right now reach a small fraction of children who are eligible, and those numbers that are eligible are just going to grow given the economic situation. And these programs are powerful in narrowing socioeconomic and racial and ethnic gaps in school readiness. We need them to adequately compensate the early care and education workforce and enable parents to work and advance their own careers. So we need universal accessibility to affordable, high quality early care and education, and expansions in public preschool, Head Start, particularly those that are full day, full year programs, and in childcare subsidies that allow for the enrollment of more children. I would argue both those currently eligible as well as those from moderate income families also struggling with childcare expenses, and that increased reimbursement rates so that salaries for workers can be commensurate with educational qualifications and experience, would likely increase parental, particularly maternal labor force participation, at least hold it steady. As I mentioned, we're probably going to lose ground in that respect. We know, for example, that an analysis of the Childcare for Working Families Act estimated that its implementation would create 2.3 million new jobs, both among parents entering the workforce as well as for new early care and education workers. So in sum, these investments would promote parental employment, generate better jobs for the early education workforce, and help promote the skills of the workforce of the future. And the pandemic highlights the need for more public investment to narrow inequalities and promote equitable economic growth overall.
Yeah, no, absolutely. It seems like there's three different constituencies almost that get, there's the kids, there's the parents, and then there's the childcare workers. All of them would benefit from a more equitable system, and the economy overall would also benefit from that. Naomi, turning to you now on this question of big structural policy change. I referenced earlier your essay in Vision 2020 with Derek Hamilton on canceling student debt. Can you explain a little bit about how that would work and what the rationale is for it?
Yeah, so I mean, the way it would work is that we would just cancel all of it. We would just no longer owe that debt. Right now we have, like during the coronavirus, they've suspended payments until September, where they're planning to restart that. And Brookings had a projection prior to the virus that about 40% of student loan debt would enter default by 2023. And we've had more than 40 million unemployment claims now. So I think that so the federal treasury could just no longer reach into people's bank accounts, and direct debit that money. They can stop garnishing people's wages. And instead of punishing people for, seeking higher education, for seeking social mobility, find a way to reward it, to try and find ways that people who are entering into higher education are not deterred from that, so that we can have like a globally competitive workforce on par with like other countries that do enable people to go and seek whatever education they want to without coming out with this big albatross of debt around their necks for the rest of their working lives. So we can just stop. And then also there's some like privately held student loan debt, and I think that the Fed, after the crisis, the Reserve bought up some toxic assets. So these would be like random shopping malls that were utilized, something like that. So banks had all of these bad assets on their books, and the Fed bought them off. And basically they can do that, but by buying off these private student loans that are usually settled on pennies on the dollar anyway. But regardless, I mean, all of it can be eliminated. It wouldn't even be macroeconomically really that difficult to do.
And a beautiful linkage between the first panel and the second panel there. That was great, bringing the Fed. Yeah, I mean, I guess even Congress recognized in their most recent bill that you talked about the forbearance for 6 months, so people aren't paying right now, but obviously a continuation of that policy or even an expansion of it would be welcome. I have a few other follow-ups for Naomi, but I do want to just mention to the audience that they should be submitting their questions. I'm going to turn to audience Q&A here in a moment. So please do submit questions on the Q&A chat function there on Zoom. I know, Naomi, you've also done work on baby bonds, this idea of seeding money to young people that then grows as they age. You probably could do a better job of explaining it than I could, but can you speak to that a little bit and how that would also potentially affect the racial wealth gap?
Yeah, sure. So basically baby bonds, it's called baby bonds, but it's actually equity. It's just some nice consonants there. But basically it's just like universal publicly funded trust fund accounts. And so everybody would get something, but the wealthiest would get the least, and the least wealthy would get the most, up to like $50,000. So you get it at birth, but you can't touch it until you become a young adult. And it's kind of growing on your behalf in the meantime, and now you gain control over it as a young adult. And so the idea of making it based on wealth specifically is to address that issue of like intergenerational wealth transfer and just like that legacy of exploitation. So even if you did it on the basis of income, it would be less well targeted in like redressing the historical inequities, because even at the same level of income, African Americans tend to have less wealth. And so that disparity is largely a function of assets rather than debts. So, solving eliminating student loans for everybody kind of like just gives people access to education and to upward mobility and to making that choice and investing in their futures. But, giving people assets kind of like, it stops the kind of creation of further disparity to eliminate the student loan debts. But the assets redresses or addresses kind of the previous legacy. But yeah, it would only be like 80 billion a year, which is about the cost of SNAP. And at the median young adult households, I have a study that came out, it was published, I guess, this year, like late last year. At the median, looking at just young adult households, the disparity is about 16 to 1 for where young white adults have like 15.9 times the wealth of the young Black adult household at the median. And with baby bonds, only 80 billion per year, it would reduce it to a factor of 1.4, which is like, so basically these kinds of social programs that we've done to build a middle class, like they could be really effective and they're totally doable. And of course, that's when they become young adults. And so a lot of that process of there's a concept of cumulative advantage or cumulative disadvantage that happens like during, once you start your job and you have differential savings rates. If your income is much higher, you can save more. And so that wealth disparity grows over the life course. So it would be almost eliminated for young adults, but we would certainly need to pair that with improving institutions so that they don't just spend it all on tuition, which imagine in 20 years where the price of higher education could land, but it could be a really useful tool.
And that tension between kind of more targeted aid versus the universal benefit. So I know there's been some critiques of the cancel all student debt proposal for, potentially being regressive because it helps, doctors and lawyers who have lots of debt, but maybe not much need. How do you, and I know you talk about it in the chapter, so I'm just setting this up as a straw man here. How do you respond to that critique? And what's your answer?
So actually a really high rate of Black graduates, college graduates go on to higher education. They're actually overrepresented in higher education or in graduate education relative to the proportion of the United States population. And what happens is though, for every level of higher education, Black people are going to be disproportionately burdened by student loan debts relative to their white counterparts. So, the idea of solving the racial wealth gap by letting those Black people who do get graduate education hold on to their debts is just it's just really not a solution at all.
Great. Well, I think I'll turn now to a few audience questions. This has been a really interesting conversation, and we've gotten some great questions coming in. So let me just take a look here. So there's talk about a looming crisis for working parents if schools can't fully open safely in the fall, but parents must work. From both a labor and childcare standpoint, what do policymakers need to do to make this sustainable, assuming the virus is still not under control? Taryn, do you want to try that one?
Sure. I mean, this is a really hard question, and I struggle with this myself. As I mentioned, I have 2 young kids, and so I empathize with many parents. I think there's so much science to be done about children transmitting the virus and safety mechanisms. So all that aside, I think what's clear is that early care and education programs and what we might consider after school programs might replace school for certain days. Childcare programs for school-age children need to meet certain public safety measures, presumably, and they'll need investment to do that. We know that K through 12 education has testified to Congress and advocated for more, or that they need more funds. to have children, fewer children per classroom, per adult, to have pods, etc. And we need that to make sure that the learning loss isn't as bad as many fear, many estimate, particularly inequitable learning loss among socioeconomic and racial and ethnic lines. But so I think that's true in childcare too. We need to make sure that programs stay open, number one, and that they have the tools to be able to pay workers adequately, particularly this might include hazard pay, but also that they can put these measures in place.
Right. We have another question here from Corey Clemmer. Can you layer on the role of the criminal justice system in this analysis? So maybe a little curveball. I don't know if anybody wants to take it. Another major obstruction for people entering the workforce and being able to, thrive economically.
Yeah, it certainly is. I think it's kind of interesting, like in the case of New York City. I mean, certainly when you think about COVID and how it's kind of spreading in jails, and we're really not addressing that problem. And we have like so much turnover between our jails and our communities, especially Black communities. So like that's kind of going to drag out the tail probably. But then there's also the issue of like just the institutions that we choose to build, in that, like, after crime fell, prisons grew in a way that was not related to one another. In fact, like virtually a identical percentage of high school seniors have smoked marijuana at some point in their lives. And yet we just imprison, Black students or Black children or Black young adults for that. And then they come out and then they're barred from, from engaging in anything. And what happens is while they're in there, in a lot of states, they're getting paid really small wages for the work that they're doing. I think they farm the fish that's sold at Whole Foods, some of it. So like in Arkansas and Louisiana at the Angola prison, so it's this kind of like heinous institution, and it's so huge, and we're kind of not dealing with it. Sometimes we try to do little things, kind of like with the Affordable Care Act, as opposed to solving the problem. But I think that as they become more and more of like an economic force, as they have already, it just gets harder and harder. So actually in healthcare, the corporation, like I want to say I don't know. Anyway, the corporation, Molina and Centene, they are corporations that provide healthcare, right? I mean, so the healthcare that we give people when we punish them, they've started to they also do Medicaid managed care, and they're actually entering into the non-group marketplace in the Affordable Care Act, which the Affordable Care Act's non-group marketplaces, they have these really high like the median deductible is like $4,000. So anyway, it becomes a bigger and bigger force and more difficult to reckon with, as that power has been like concentrated, but specifically into this really unnecessarily violent, just like destructive facet of our society.
Yeah, and to layer on to everything that Naomi said, there's a worker voice dimension to this as well. Some really fascinating research from my Columbia colleagues, Adam Reich and Seth Prince, showed that people who had spent time in the prison system, formerly incarcerated individuals, are much less likely to both join unions and try to form unions or express worker voice at their jobs, because they're so fearful of losing the precarious position that they have in the labor market. We have so much research to suggest that these folks have a really hard time even getting a foot in the door, that they're discriminated against in systematic ways. And so when they finally find employment, often at places like Walmart, they're reluctant to do anything that could result in them losing their jobs. And therefore they're missing out on this important element of voice in the workplace.
That's a really interesting angle, Alex. So one other audience question is, what is the most important lesson each of you think we can learn from policies passed during the Great Recession or Great Depression? So I don't know to what extent those will end up being corollaries to our current experience. Alex, I know the National Labor Relations Act of 1935 was passed during the Great Depression. I don't know if you want to speak to that, or if others want to jump in with kind of lessons from recent economic, I guess not that recent in the case of the Great Depression, but in other economic crises the country has faced.
Sure. I mean, I think it comes back to where you started us, David, which is to say, was there an element of structural reform that not only provided relief for the economy in the moment that we're at this crisis, but did it actually change the way in which the economy functioned? And I think that's what made the New Deal so pivotal in structuring the American economy. It changed the rules of the games and created new institutions, in particular for workers and less advantaged people, to have a say both in the economy and in the democracy. And so it remains to be seen whether we'll have a similar moment now, but that certainly wasn't the case during the Great Recession. You didn't see that same kind of institution building that endured past the relief efforts.
Yeah, I would say that's true with early childhood too. I mean, what happened during the Great Depression was actually World War II precipitated this huge investment in direct public provision of childcare, the Lanham Act, which it just was created because so many mothers had to go to work and replace men who were fighting overseas. And it was recent research has shown it was improved child outcomes, and it was a success in many respects. And it just dissolved. I mean, all those public provision of centers dissolved as men came back and women receded from the labor force. And during the Great Recession, there was certainly an analogous kind of investment, and in many ways, childcare subsidies, which with their funding remained flat across much of the last decade. Not the last 2 years has been different, but as a result, fewer children received subsidies. There was a bump in Head Start dollars during the Great Recession, which was really important for many kids. And so we can learn from those examples.
Yeah, I know Sam Abbott on our staff at Equitable Growth wrote a piece on the World War II experience. And yeah, what a missed opportunity there not to kind of keep those investments sustained as opposed to letting them dissolve, like you say. Naomi, do you want to get in?
Yeah, I think that what to keep in mind is that the initiatives that we're going to undertake are going to be successful. We just have to be really careful about what our long-term goals are. And I think that, we want to, and especially contrasting with how we reacted to the financial recession of 2008, is like benefiting people over markets and all people. Especially those who are the most vulnerable, because if they're made better off, everyone is. If you think, so to quote Derek Hamilton, my co-author on that piece, the household that's in poverty, almost by definition, has to consume the marginal dollar that they're going to receive. So when we build up the most economically vulnerable, that's what spurs aggregate demand. And like a lot of corporations have revenue problems, actually, even prior to the coronavirus. So we can spur aggregate demand by lifting up the most vulnerable, and I bet it'll work.
Well, on that optimistic note, unless there's any other final words people want to say, I think we'll have to end it there since we're almost at time. But I want to thank the audience for their attention and good questions. I want to thank Naomi, Taryn, and Alex for their presentations, as well as Emma and Marissa and Heather from the first panel. There, as Heather said, lots of Equitable Growth staff that helped make today possible, so I want to thank all of them as well. Please stay tuned for more Equitable Growth and Vision 2020 content that is going to be focused on the coronavirus recession and the 2020 economic policy debate going forward. Every day we're posting new material on our website, equitablegrowth.org. And as I mentioned earlier, the link to the event page that we posted in the chat earlier will take you to a slew of additional materials, including a PDF that summarizes the policy recommendations that were laid out during this panel at the Vision 2020 book. So yeah, thanks so much for your attention, and we'll see you either virtually or in person sometime soon, I hope. Thank you.